Alrighty, today we're talking about BMI and all the buffoonery that comes with it. Welcome back to Fuck Calories podcast. I'm Dr. Soleil. That's Dr. Sarah. So, Dr. Sarah, tell us or hit us off a little bit of maybe what is BMI and why is it still in the medical system? Or, yeah, why do we still use it?
Yeah, it's crazy actually. But basically, it's a mathematical calculation of the ratio of your height to your weight. And if you are trying to do very quick estimates along a large population, or if you are trying to like generalize, it's or quickly, dose a medication based on your body size, it's a reasonable estimate. Um, but it is so void of nuance and it is so inaccurate in so many circumstances.
Hmm.
So anyway, so that's the reason why it was originally created. That's kind of the reason why it's become so pervasive is because it's so easy.
Hmm.
It's literally requires like, you just have no, pretty much most adults know how tall they are. And most adults, obviously there's some fluctuation, but most adults know roughly how much they weigh. And so
Hmm.
if you're trying to get a very quick calculation and you say, "Hey, how much do you weigh? How tall are you?" Most people know that. And so it's a very quick and dirty way to get a rough estimate of someone's approximate size that they take up in space.
Right.
And so that has been useful. I think you were telling me about like if you're talking like an airplane or an astronaut with like the size and how to like configure seatings and stuff like that. Like it's a
Hmm.
reasonable estimate. If you're trying to very quickly estimate or generalize across a population, it's a reasonable estimate. It's quick and dirty estimate. But it is
Hmm.
not at all accurate for if someone is trying to change the shape of their body, if someone is trying to track their own progress, it is a terrible measurement, and we should totally get away from BMIs. We should honestly totally get away from even weights
Hmm.
because it is totally inaccurate, and you can actually be improving the composition of your body, but decreasing or making your BMI potentially look worse, or even making your body weight look worse. And so that's kind of what we're going to talk about today. So I guess first of all, why in the world would someone even care about the composition of their body? What does that even mean when we say body composition? What are we talking about?
Yeah. So I start thinking of, okay, how much lean body mass, how much of my bones, healthy bones, and how much adipose or fat tissue do I have and in which distribution, right? That can tell us a lot of information about your health because if the adipose tissue or the fat cells are underneath your skin versus visceral fat, which you might have heard of as well, that's the fat in between the organs, like that deeper fat. And that you can still be pervasive and people that look thin and skinny. And so they get called skinny fat a lot, right?
Mhm.
Because it causes a lot of health issues as well. So absolutely, I just want to reiterate the fact that we're still using weight and like how much space you take up, right? In our environment has nothing to do with how healthy you are. It's
Absolutely.
truly right in 1830s. It was a mathematician. He was from Belgium, and he's like, you know what? I just wonder what's the average size of a white European man. And so he did calculations, and that's how he did it. Now, that's great if you're a mathematician and you want to keep that average in math. The
Yeah.
problem, right, is that we plucked out this little number from obscurity in the 1970s and we started using it in the health field.
Yeah.
And that's when people are like, oh, I guess I am now obese and I am class 4 obese and like, oh my gosh, who knew, you know what I mean?
Yeah.
So there's different kind of staggerings with that. What it does not take into consideration is this body composition that you bring up, right? Because if we think of lean muscle mass is denser than adipose tissue. And what we now are talking about is to weigh the same, right?
Mhm.
Um, it takes up smaller amounts because there's
Yeah.
more, it's more dense, right? This could be 5 pounds of muscles over here. But if you change it to adipose tissue or fat cells, now this might be 5 pounds.
Yeah.
They're both weighing the same. And so when you do this calculation of BMI that only has two numbers, your weight and your height, it really doesn't tell me what does that mean? Does that mean like I'm an Olympic triathlete?
Yeah.
Or does it mean like I'm a sumo wrestler who are also very strong but tend to be
Yeah.
larger?
Yeah.
Or right, etc. So yeah,
Yeah.
body composition is a huge missing factor, I think, in BMI. The fact that we are still using BMI is much to our detriment because it tells
Mhm.
us nothing. But it's one of those things that insurance companies have glommed onto that we continue to have to put it in charts. And when
Yeah.
you ask for certain things, they're going to say, "Do you even qualify?" And you have to qualify
Huh.
for certain things in medicine per right
Yeah.
per BMI, which is
Yeah.
insane. So
Yeah.
yeah,
Well,
tell
and
me
I
a little
think
bit more. Yeah.
one of the tricky things about it is that body composition, meaning what is your ratio of your lean mass to your fat mass, is so critical and so important for your metabolic health and understanding, like longevity predictors. Your
Mhm.
metabolic health predictors are largely determined by your lean body mass.
Mhm.
And so the amount of muscle mass that you have on your body will as you age determines how long you will continue living. And it regulates and determines the rate at which you age. And so lean body mass is so critically important. But the reason why I feel like we don't use it enough and we kind of gloss over it and like nobody really talks about it is because it is more challenging to get a measurement.
Yeah.
It is going to require a little bit of more invasive or more expensive test. It's not something that, I feel like every adult knows roughly how tall they are,
Mhm.
and most people know approximately how much they weigh. And so like people just know that, but you don't just know your lean
Right.
body mass. You have to actually like go and get a measurements. There's many different ways that you can do it. One of them is with a DEXA scan. So people may have heard about getting like a DEXA scan in relation to their bone density,
Mhm.
because that is something that is recommended in women as they age to rule out osteoporosis and things like that. But the same technology, not only can it check the density of your bones, it can actually just check the density of all of your tissues.
Mhm.
And so the looking at the density of different tissues is how we determine actually how much lean mass you have versus how much fat mass you have. And the lean mass is going to include things like your bones, your most of your organs. There's some variability with that. All of your muscle tissue, your bone marrow, all of that stuff is going to be mostly included in the lean mass, except in certain circumstances with the bone marrow. I shouldn't have mentioned that, but anyway. And then your fat mass that can be divided into the visceral mass, like you were talking about earlier. So that's the fat around the organs.
Mhm.
And then also the appendicular mass, meaning or appendicular fat mass, which is like the fat that you hold onto your arms and on your legs and things. Women, especially on our
Mhm.
butt and hips. That is a different measurement of fat mass. And our lean body mass is super important for our metabolic health. And so when we are talking about ways to process the food that we eat and to metabolize the food that we eat and where we are partitioning the fuel that we take in, whether it goes to becoming fat mass or if our body is utilizing it, if we have a low lean mass, we won't be able to use as much and we won't be able to partition that fuel that we eat into being able to use it in a healthy way versus being able to use it in a way that is metabolically detrimental. And so that is the reason why it's so important. But you you have to go like get a DEXA scan.
Right.
There are other ways that we can actually look at it. There's like some impedance scales. You can buy ones at home that are, I think I bought ones many years ago that was like $45 at the time, but that was like before COVID and COVID inflation. So I don't even know what they are now. But there's also like some that you can get like in a doctor's office that are a little bit more high tech, a little bit more accurate. They kind of partition your body in different ways to kind of be a little bit more accurate. And those also are a reasonable estimate. It's not as good as a DEXA, but it's a reasonable tool to figure out how much your lean body mass is versus how much your fat mass is.
Right.
And so
Absolutely.
I think one thing that's like really important when we are talking about these different GLP-1 medications is that I'm sure that our audience has seen that there's a lot of uh, like blame and griping and clickbait titles and little clips on Instagram and stuff about losing lean body mass.
Mhm.
And like there was a video that came out from a influencer that said like all of the weight you're losing is going to be your lean body mass. And if you do nothing proactive, you can lose a lot of lean body mass,
Mhm.
just like you can lose a lot of lean body mass in nearly any dietary program.
Mhm.
Um, but in order to, if you're going to be proactive, then you're increasing your protein intake, you're doing resistance strength training exercise to help
Mhm.
preserve that lean body mass. And one of the things that at least I have experienced, I think our audience has heard my history, but I have done unfortunately, a lot of yo-yo dieting in my life. And I think that metabolism has a memory and, and it like knows these things that you have gone through. And one of the really tricky things is that if you just straight up calorie restrict, you will lose, yes, you can lose body fat, but you will also lose lean body mass in a similar ratio. And
Mhm.
so at the end of the day, if you try to calorie restrict for an extended period of time, your body weight, yes, has gone down. If you step on the scale, it may be decreased, but your fat mass and your lean mass you will have lost in similar ratio. So you haven't really improved your body composition. You've just gotten lighter, which is
Mhm.
irrelevant. Um, and then what tends to happen is if you yo-yo and then you regain, you don't so if you lose them in 50%, like in a 1-to-1 ratio, if you're losing lean mass and like say you lose 10 pounds of lean mass and say you lose 10 pounds of fat mass, which tends to be what happens if you do nothing, if you just are just straight up starving yourself. Um, but then when you regain, you don't increase them in the same proportion. You tend to only put
Right.
on fat mass. And so
Mhm.
if you use the GLP-1s with no context and just completely, doing whatever, or if you starve yourself with no intervention and no thought about your lean mass, then yes, you're going to lose lean mass. And
Mhm.
so if we are, trying to be proactive for our metabolic health and trying to become healthier, then if you are going to be on these medications, you have to take care of your lean mass. And so we've been talking in the past few weeks about the different types of diets and the different types of um, protein options, and that is part of the reason is because we, at least in my experience, I have found that is you can actually really preserve and specifically target losing fat mass if that's what you want by doing these interventions, including having a high protein, focusing on getting good protein intake, and doing resistance and strength training.
Absolutely. And fantastic benefits for our metabolism, right?
Yeah,
And just
yeah,
health in general.
yeah.
But I think if we're talking health in general, I'm going to circle back and say BMI is an absolute worthless number to
Completely
know.
agree. Completely agree.
And a lot of times your weight is going to also be maybe the second most worthless thing to know.
Worthless. Yeah.
Because unless someone is actively picking you up on a
Yeah.
daily basis and it matters to them and their back health, like how much you
Yeah.
weigh,
Doesn't
right? It
matter.
doesn't matter.
Yeah,
But other things like what is my muscle mass and what is
yeah,
my bone density, right? And
absolutely.
in order to preserve my bone density to prevent osteoporosis or osteopenia, you have to have that skeletal muscle on it that continues telling the muscles to rebuild. You're
Yeah,
going to live a longer, healthier life if
yeah,
you get enough protein in and you keep protein, basically skeletal muscle, on your skeleton.
yeah,
And we see that all over the place, right? So,
yeah.
you talked a little bit about those scales you can buy
Mhm,
at home and
mhm,
possibly doctors' offices having a little bit higher scale.
mhm.
But I'm going to circle back those DEXA scans. I have done one myself just to see kind of where's my skeletal mass and what's my adipose
Same.
ratio. I wanted to kind of see because again, weight only tells me so much, and my
Yeah.
clothes really only tell me what size I order from said store, right? It really
Right,
doesn't
right,
tell you much. So I
right.
went up to the cities and walked into a place and was able to get a DEXA scan for $150, which is not bad if you're
Yeah,
looking for a one-time kind of, hey, I want to do this year and then
right,
start on my health journey. And then in
right,
another year, I get another one, right?
right.
And you can
And
really
track my
start
progress.
comparing apples to apples.
Yeah.
Is that something that maybe is the best tool for patients to use? But it's a little bit more expensive, but it's not like all the time, right? Like you're not getting a
Yeah.
DEXA scan once a week or,
Right,
anything like
right.
that. What other modalities do you think other people could use?
So there's a number of different metrics, but before we get to that, I wanted to kind of say something else on the line of of getting a DEXA
Yeah.
scan. Just
Mhm.
in case people are worried, basically it works kind of like getting multiple X-rays. And so what that means is that just in case anyone's worried, the
Mhm.
radiation involved is extremely low.
Mhm.
This is like a fraction, a tiny, tiny percentage of the equivalent of a CT scan. So the radiation involved is very low. And we're talking, this is if this is something that you wanted to track your progress, I probably wouldn't recommend doing it more than every 3 months. Not
Mhm.
because of radiation problem, but just because it's really hard to see a difference. Like it's gonna
It
take
takes
a
time.
lot of time.
Mhm.
Exactly, a lot of time. This isn't, like you can I'm just gonna be really frank here with our audience, like you can weigh yourself and then take a dump and then weigh yourself again and there will be change.
Mhm.
A
Mhm.
DEXA is not like that. So it's actually measuring the size of your whole entire body mass. And so it's something that's going to be very slow. And so I would probably recommend not getting a DEXA. I'd say the minimum would be every 3 months, but I think most commonly I've seen it recommended, every 6 months or every 12 months even.
Mhm.
So I think that's something that we should keep in mind. And then the second question is, you found a DEXA to go to. I did as well. And so I was going to ask you, is this something that you need to get a prescription from your physician? And if you do get a prescription from your physician, what kind of DEXA are they thinking versus like, where did you get it? How did people find this online if they wanted to go do one themselves?
Right. So I know when I was looking, I basically just went on the internet and I was like, where can I get a DEXA? And then I even called it, I think, a DEXA health check,
Hmm.
Delta, and then something DEXA like fit scan came in.
Yeah.
And I wanted to confirm they were going to give me the information I wanted, as
Yeah.
opposed to getting a prescription from your physician, which this, because it's completely out of pocket, it doesn't go through insurance, it doesn't go through anything. It's cash pay. You walk in, my place didn't even record, they were just empty that day. They're like, we'll
Yeah.
do it you right now.
Yeah.
Some of them you just call and say, hey, I want to make an appointment, right? But no prescription or anything required. You don't even have to share it with your doctor if you don't want to.
Yep.
I think it's
Yeah.
great info for them to have, but
Yeah.
it's
Yeah.
totally yours. As opposed to a prescription for a DEXA bone scan that
Yep.
does go through insurance and is usually covered. Again, this is mostly for older women that
Or
will have
people
it
with risk
approved through
factors.
their insurance, right? And they're looking for signs of bone weakening or osteopenia or osteoporosis.
Yeah, I completely agree. I had the exact same experience. I just Googled, I think I at the time had Googled something like DEXA and then also body composition, like all in one phrase. And I found several places in my area that were willing to do them. Kind of like you mentioned, some of them had other fitness tests as well. Like they would also um, do calorimetry to check your basal metabolic rate or your VO2
Mhm.
max and all of these other things. Typically, oftentimes those are geared towards professional athletes, but oftentimes they're not, and so you can often find them just in the community. And
Mhm.
I had the exact same experience, exactly how I found mine. I agree. I also didn't tell my doc. I just went and did it. And I completely agree. If you do ask your doc, they're probably going to send you to a hospital scanner, and the tech there is only going to be looking for bone density.
Right.
Because unfortunately, this is like the only place that we have been like, routinely using these in the population is for bone density, which is, I
Mhm.
think, really unfortunate. I hope that one day
Right.
this changes.
Mhm.
But it is something that we can just go be empowered and go do ourselves. So, and
Mhm.
then we can track it ourselves as we are on a fitness journey. Even if you
Mhm.
don't want to change your size, if you just want to increase your muscle mass, it's a
Yep.
really wonderful tool.
Absolutely. Just changing your body composition to a healthier, right, fitter you.
Yeah.
Um, because it's not all about the size of the body that you're in or how
Right.
much weight we are carrying, right?
Right.
But it's a what can I do right now to put myself in the best position for my health for tomorrow and for the next however many years I live, right?
Yeah.
Um, Other things that people can sometimes use is just a simple measuring tape. I use a
Mhm.
flexible measuring tape at home. And what I'm looking for is kind of my proportions, but also abdominal circumference is a huge one, especially if we're talking about metabolic disease or metabolic syndrome, right? We have seen that the larger your waist circumference is, it does mean you are probably holding subcutaneous and visceral fat, which
Mhm.
leads to worse health outcomes and is a marker for such things, right? Like metabolic
Yeah.
syndrome. Is that tied into insulin resistance or prediabetes or type 2 diabetes, or you know what I mean? And then it just continues to go. But it's a nice little thing most of us have. And I use the flexible measuring tape like the one you're going to use for sewing your stuff. If
Yeah.
you use a hardware measuring tape, it's not going to go well.
Yeah.
I'm just going to tell you, it's not very bendable, and you're just like you get
Yeah.
frustrated.
Yeah.
But that's a nice, I think, less expensive way that you can also
Yeah.
just say, like, listen, I'm going to continue working on my muscle mass, but I just want to check once every couple of months that my waist circumference is where I need it to be, right?
Yeah.
And if it starts maybe going in the direction you don't want it to go, do we bring this up to our attention of, oh, is it because I've been eating a certain way or not exercising or maybe not doing my strength training, or is it leading to bigger things? Should I talk to my doctor or physician about this? Um, about, hey, what does this mean? And is this an early red flag for something I can catch now and quickly reverse before it becomes, right, something a little bit
Absolutely.
bigger?
Absolutely. One that is very similar to it's very similar to waist circumference, but is a little bit more accurate in certain populations is your waist to hip ratio. So it is also a
Yes.
waist circumference, but using
Yes.
it in a ratio to your hips can
Hmm.
also tell the distribution of your um, where your visceral fat is.
Yep.
It's a little bit of an estimation. So for certain populations, certain ethnicities, certain genders, it's can be more useful, and it's
Mhm.
basically requires the same technology as doing a waist circumference. So
Yep.
whichever people prefer to use. Yeah.
Absolutely. And I think it absolutely gives you more information. Yes, I am so glad you brought that up. Because like to me, I'm like, oh, I just do them at the same time. But yes, it
Yeah.
is
Yeah.
absolutely measure
Yeah.
both places, write it
Yeah.
down, look up those ratios online. I think it's going to give you much better understanding compared to BMI, right?
Like,
Because BMI is bullshit and
yep,
we got to get away from it.
absolutely. So
So, any other things we could be maybe measuring or tracking besides BMI and the other things we've talked about?
absolutely. So I think this kind of comes down into kind of two categories. Are we measuring for health? Are we measuring for body composition and those types of things? And so some of the other measurements that are much more intuitive or much more that give us a lot more insight about your metabolic health are going to be including things like your resting blood pressure, your resting heart rate, your even your HRV, or which is your heart rate variability overnight, for example. And then there are other things that are for like athletic performance. You can look at your VO2 max, you can look at your grip strength, etc. There's a lot of overlap though in all
Mhm.
of those. I didn't mean to like completely categorize them in different things. It would be awesome if every single physician's office recorded your VO2 max, but they probably are not going to. um, when you were talking about like performance and our longevity and the ability to go through menopause and live a life of vitality,
Mhm.
all of those many of those measurements have been shown to increase your quality of life as you
Mhm.
age. So grip strength has been associated with longevity and decreasing of pathologic fractures as we age,
Mhm.
and decreasing fractures that land you in the hospital that you often don't recover from.
Mhm.
And VO2 max has been significantly correlated with quality of life as we age. So I
Yes.
think there are many different other measurements that we can all be tracking and kind of researching which ones we feel like are appropriate for ourselves and or all of them
Mhm.
and tracking them as we go through a fitness journey. Like say you were to get on a GLP-1 and maybe you don't have the ability, maybe there's not a DEXA near you, maybe there's not all these different availabilities, but you can measure your own grip strength. I mean, that's something that you can do and track yourself as you um you know work on your body.
Yep. Absolutely. Um, as we get older, I'm going to throw in one too that's called the get up and go. And it's
Oh,
getting up
totally.
right? Out of
I'm so
a
glad you
seated
brought that up.
position. Yeah. So getting up quickly out of a seated position and going. So get up
Yeah.
and go. And as we age, as we lose, I'm hoping not us, right? This community,
Yes.
but as people lose skeletal mass and that lean muscle strength, they now need help getting up out of that
Yes.
chair, and their length and time it takes them to literally get up and start going is much longer. And
Yeah.
that is a nice quick check of like, hey, that's not fast enough. I have to start working on my balance. I need to start working on my strength training again, because we can still reverse that if
Yeah.
you, right, if you catch it. So,
Yeah. And,
um,
our audience is probably thinking, why in the heck are they talking about like these tests that are often used in older adults? And I think the reason that we are is that we know that once you hit midlife,
hmm,
starting in your 40s to 50s, whatever lean mass that you have and whatever grip strength that you have and whatever body composition that you have, it tends to deteriorate by a small percentage every single year, no matter what you do.
right.
And so it's really important that we optimize ourselves as soon as possible, as young
Hmm.
as possible, and then the entire rest of our life, once we hit that peak, wherever our genetics determine your individual peak will be,
Hmm.
then we have to fight against losing that for the rest of our lives. And so for those of us like me, like myself, who have unfortunately done quite a bit of metabolic yo-yoing for our early years when I should have been putting on lean mass, it's going to be really, really important going forward that I really strive to maintain that even as I'm changing my body composition and even as I'm, trying to decrease my visceral mass to improve my metabolic health. It's really important that I am trying to maintain my lean mass and I don't just completely forget about that and say, whatever, I just want to be in a smaller pant size because
Right.
it will be to my detriment as I age. So,
Yes. Yep. Absolutely. So, yeah, I think the only other calculation or thing that to measure would possibly be sleep. Um,
oh, yeah,
right? That's a huge one that's easy enough to forget about. And if you don't know the importance of sleep, please go back and watch our previous episode where we talk about sleep and how it will cause mass chaos in your life if you're not getting enough sleep, right? So we're not even talking emotionally, psychologically, but socially and physically, health wise.
yeah,
It is a huge issue. We should be spending a third of our time asleep every single day, which is insane, right? When we
yeah,
start thinking about like all the things I have to do today, do
yeah,
you schedule also in a third of your day for sleep? Very important for health. So
yeah.
maybe that's what we leave it on. But any other tips or tricks for us today, Dr. Sarah?
That's all I got.
Alrighty. So we'll see you guys on the other side, but thanks for staying with us today. Have a good one.